Hello all, Dan White's training with a very important video, so do not skip this video. This could help save a child or baby's life. So we're just going to go through the resuscitation process for whenever you're dealing with a child or a baby, and this is what we need to think about. Okay, so if you're in this situation, hopefully you never are, but if you have a child or a baby not responding, collapse for any reason, the first thing we do is make sure it's safe for you. Don't go rushing off into danger, make sure it's safe and the area is safe that you can approach them. Always have a very quick check for what we talk about as catastrophic bleeding. So lots of blood spraying and stuff. We need to stop that as soon as possible, and I will do a video on that at some point. So check for danger, catastrophic bleeding, no signs of that. See if they're awake, check for response. Babies, we'll start with them. Tickle feet, tap feet, check for hand reflex, clap. We're looking for any sort of movement, gripping, waking up. If you're dealing with children, talk to them, tap on shoulders, shout, and see if they wake up. Now, if they do wake up, great. Right, find out what's wrong, and we'll go from there. But worst case scenario, there's no response. They do not wake up, and it's really important that we shout and scream for help. If you've got your phone on you, put it on speakerphone, dial 999, but do not leave. Scream, shout, speakerphone only for now. We need to check that patient's airway. If you notice signs of vomit, we want to get that vomit out, let gravity do it, get them over, gently open airway, let it drain out. If there's no signs of vomit, we're going to open that patient's airway. With little babies, you have to be very careful. So forehead grip, little finger there, tip head back gently, neutral alignment. If you go too far back, you'll hyperextend, shut the airway off. Children, forehead, two fingers, tip that head back. You shouldn't be able to hyperextend a child's airway, so don't worry too much. If you need to, use the thumb to make sure that mouth is open. And all this does is get that tongue out the way and clears that patient's airway, hopefully. They might start coughing, spluttering, and coming around. Now, if they don't, we need to assess their breathing. And what we're looking for is normal breaths. So we're going to do a 10-second check, and we're going to look, listen, and feel. So the way we're going to do that is keep this airway open. Bring your ear right down, look along that chest, see if I see any movement. Can I feel it? Can I hear it? And we're going to do 10 seconds. And if you're doing it for a little baby, just make sure you're looking at the tummy also, because you might see more movement there. And it's very tricky to look at a baby's chest when your head's there. So try your best to keep that airway open, a good 10-second check. Now, worst case scenario, there's no normal breathing. So this could be no sounds at all. It could be gasping, snoring sounds, any of that. That's not normal. You need to start resuscitation. If someone's there, they ring the ambulance. If you've already got it on speakerphone, you tell them what you're doing. But if you're by yourself, your phone is downstairs, do not leave. You must start resuscitation and do it for at least 1 minute. And we're going to start with rescue breaths. So this is trying to get some oxygen back into this patient. So if you are dealing with a tiny little baby, under 1, we're going to just gently keep that airway open. Use your mouth to cover that nose and mouth and give 5 tiny little breaths. And each time, get a fresh breath. If they're a bit bigger, we can blow a little bit more, and it's slightly different. So we get the airway open and we pinch the nose. Babies, they're quite small, we don't need to pinch the nose, but for children, any bit above 1, pinch that nose to stop the air you're blowing in coming out of that nasal passage. So we get that airway open, open mouth, and again, we want 5, taking a little fresh breath each and every time. So 5 initial rescue breaths for anybody under 18. Then it's onto the compressions. So this is the part where I'm going to push on the chest, circulate that blood for them, and hopefully get some of that oxygen around the body. So if I'm dealing with a small baby, we're going to aim for 2 fingers in the dead center of their chest. So we're aiming for that armpit line, dead center of chest, 2 fingers. We're aiming to push about 1/3 of the depth of the body, 4 centimeters. We want to do about 120 beats per minute. That's 2 a second. So dead center, 2 fingers, pushing that third. Do not worry. People panic if they don't want to push too hard, but you need to push hard. All right, 1/3, 120 beats, 2 a second. Maintaining the little airway on a baby may also help get a little bit more air in there while you're pumping. So dead center, 30 compressions, then back to 2 breaths. For a child, the compressions are slightly different. So anybody above 1, get dead center of chest, right? Heel of one hand this time, lean right over, get your arm straight, lock in your elbow, and push that 1/3 again, roughly about 5 centimeters. Real children won't click like that, but if you do hear a cracking, crunching sound, do not worry, just get on with it. So dead center, 120 beats, 30 compressions. If you find it really tricky, you can move to 2 hands. So interlock your hands like this, pull the wrist back, heel a hand, right over. But if you can do it with 1 hand, do it with 1 hand, okay? So we start with them 5 breaths, then 30 compressions, dead center, 120 beats. We want to make sure we're pushing that 1/3 of the depth of the body. Once you've done 30 of them, it's back to 2 breaths. So the process will be 5, 30 to 2, 30 to 2. If you're by yourself, 1 minute's worth of CPR, roughly 3 cycles, then you can leave, put them on their side first, get your phone, come back, 999 speakerphone, and carry that process on. There's a defibrillator available, get on with it, get someone to get it. But please just try not to panic, don't delay this process. If you leave them to go call for an ambulance, you could be delaying vital oxygen. If you've never done it before, you're a bit worried, just anything is better than nothing. If you want more information, then you can contact us and join one of our courses. But this is just a basic little video to show you how to do it. So please like, follow, subscribe, and share. And thank you very much for watching.